we have another discussion that we want to get to that's really raised a lot of eyebrows, especially for women and for those who love us, who are concerned about our health. Hormone therapies. This is coming from the Food and Drug Administration on Monday. That hormone therapies for menopause will no longer carry a black box warning about serious risks such as breast cancer, heart attack, and stroke. Again, that's a new announcement from the FDA on Monday. I want to go ahead and bring in Dr. Susan Scanlon, certified menopause practitioner and president of Midwest Center for Women's Healthcare. Thank you so much for your time. Appreciate talking to you as always.
Thank you for having me on.
Absolutely. Give me your reaction to hearing that first and foremost.
I think it's a great day for women's health that they're going to release that black box. That's has been a fear barrier for a long time to both patients and physicians. Patients, when they read that, even if their physician has prescribed hormone therapy, goes home, takes out that package insert, and does not want to initiate the hormone therapy despite all the known evidence now of long-term health with hormone therapy use. And furthermore, the physicians are more comfortable now utilizing hormone therapy if they don't face a black box warning. It will still contain some warnings in there. For example, uterine cancer risk is higher with the use of unopposed estrogen. Number two is that closer than 10 years since your completion of menopause and under the age of 60 is what's recommended. And then third is that local estrogen therapy is beneficial, whereas they're still studying some of the other forms of hormone therapy to still talk to your doctor about those. So there will still be something in a black box, but the overall blanket statement is what's being released. And I think that's a great day for women's health.
That maybe it goes too far and then kind of scares people from even doing it. And these are commonly prescribed, but some people have said that this new advisement, this new guidance here is based off of outdated science and that it discourages women from taking hormone therapy.
Yes, you are correct. So when the Women's Health Initiative study came out, it was intended to look at the risks and benefits of hormone therapy. Well, the early findings were released too early without adequate interpretation. And it went right to the media rather than to the medical community. And what the highlights, the headlines said were, hormone therapy causes breast cancer and heart disease. So any doctor working that day, I was working that day, had patients come in, they're like, did you see the morning news? Hormone therapy is causing me harm. I'm going to get cancer and heart disease. So here we didn't even have a conversation as a medical community on how to handle the information.
Mm-hmm.
The study was discontinued early based on that misinformation. And unfortunately, it led to 2 decades of women not receiving that option for hormone therapy. And that was really a detriment to those patients' long-term health.
Yeah, and you've been a longtime advocate of hormone therapy, as I'm seeing here. So tell me some of the other myths or misinformation you have had to debunk in the years.
About hormone therapy? Sure.
Yes.
Well, one big example is vaginal estrogen therapy is safe for breast cancer patients to use. It does not cause an increased risk of breast cancer, and it does not cause a recurrence of breast cancer in patients who use a vaginal approach for estrogen therapy. So patients who suffer from genitourinary syndrome, which is pain and dryness, really, it's great for them to know that they don't have to suffer with that. And there is a treatment option that's available and safe to use.
And I guess, for women who maybe are in perimenopause and kind of looking ahead, what steps would you say? I mean, do you say hormone therapy is something that someone should start at what age, or what kind of triggers say they may need hormone therapy?
Sure, that's a great question. A lot of patients come in when all of a sudden they feel like they're not really in charge of their life. They used to be able to manage their household and their job and everything in between, and it's just all of a sudden they feel they just don't feel themselves. And so hot flashes, night sweats, joint pain, increase in headaches, painful sex, lack of an interest in sex are are really common symptoms that bring them into the office. There are thankfully a lot of treatment options because for years, when doctors were hesitant to use hormone therapy, thankfully other treatment options evolved. But hormone therapy, really, for the majority of women who are healthy in the early stages of their perimenopausal transition and into menopause, have hormone therapy as a safe treatment option. So talk to your doctor. If your doctor's not really comfortable, I'm a certified menopause practitioner. There are a lot of doctors who have a focus now on menopause. So talk to your doctors about the pros and cons and all the options available to you.
Can you talk a little bit more about the importance of your specialty? Because I remember Halle Berry came here to speak not too long ago, and she was talking about the fact that a lot of doctors aren't comfortable having that title.
Oh, sure. There's so many aspects to the field of obstetrics and gynecology. Most doctors are drawn to obstetrics. It's a joyful part of the job. Gynecology is surgically based and also office based. Well, one aspect of it is menopause. I have taken care of patients for over 25 years with menopause, been a certified menopause practitioner for 15 years. So it's a big part of my practice. I'm very comfortable with it. With all the treatment options. But a lot of doctors, partially because of this black box in the prescribing information, were hesitant to even offer it to patients. Most OBGYNs, at least, are educated on the topic to some degree, but your internal medicine, the primary care doctors, really have not have had adequate access to that information over the years. And so they oftentimes are very uncomfortable with the information. So seeing a certified menopause practitioner is considered a menopause expert. They're fully passionate about the topic and really can give you all the pros and cons of the different treatment options, not just hormones, but everything else, and get you onto the path of feeling better.
Yeah. And speak to me, maybe on a final note, about the reaction you get from women who may have been very apprehensive, let's say, to try hormone therapy and then give it a go.
Yeah, I think the most important thing is to have a conversation with each individual patient in an individual way, because everybody's experience is so different. And so really listening to the patient, what are your symptoms that bother you the most? And you oftentimes can't fix everything in one office visit. So we try and tackle the top irritating symptoms that they have and go through the pros and cons of each of those choices, the risks, the benefits, what the side effect profile is, and decide together which treatment choice. It's always interesting what patients pick. Sometimes when they come in, they're like, I definitely want hormone therapy. And then when you listen to them and they're like, you know what, my issue is really joint pain, and I really don't want a medication. What can I try? We talk about hormone therapy, but then a supplement such as glucosamine chondroitin is a nice option to consider. Increasing their exercise is one type of example. Or if people have painful sex, and they don't want to try a medication quite yet. There are moisturizers that contain hyaluronic acid that maybe they want to try first. So it's always interesting what patients end up selecting, but the most important thing to me as a doctor is that you are educated on the choices and that you give your patient all the choices, because it is her life and she gets to choose what she'd like to do.
Dr. Scanlon, you are excellent. I'm going to jot your name down myself. Thank you. Appreciate you.
Thank you. Have a great day. Thank you.
You too. Take care.